We will start today's program with some opening remarks from Dr. Ronald Copeland, Senior Vice President of National Equity, Inclusion, and Diversity Strategy and Policy, and Chief Equity, Inclusion, and Diversity Officer for Kaiser Permanente. In this role, he leads Kaiser Permanente's program-wide efforts to ensure our strategic vision is successfully implemented to drive business and mission outcomes, empower communities that we serve, and result in all Kaiser Permanente members achieving health and healthcare outcomes that are high quality, equitable, and increasingly more affordable. And with that, I will turn it over to Dr. Copeland.
Thank you, Murray, and welcome to all our guests. I appreciate the opportunity to make a few opening remarks on behalf of Kaiser Permanente's sponsorship of this particular event. Kaiser Permanente has a longstanding commitment to equity, inclusion, and diversity. Throughout our 75-year history, we have consistently taken a stand for equity, inclusion, and diversity and social justice. We view this commitment as inextricably linked to our mission and our service as one of the critical foundational pillars upon which we have built our enterprise. Our vision is anchored in our strategic framework regarding what we do in the health equity realm, the workforce equity realm, and the community equity. And it serves to focus on a vision of equity and inclusion for all that we are privileged to serve. Some examples of our taking a stand, if you will, has been since our founding years, taking a stand against racial segregation of hospitals. We were early adopters of the culturally and linguistically appropriate standards for culturally responsive care, published by the Office of Minority Health, have built them into standards and practices across our care delivery system. Eliminating healthcare disparities, we did a large body of work over 10 years ago, demonstrating that we could identify root causes of disparities, identify effective practices, and in fact, demonstrate closure and narrowing of those disparities gaps in several critical areas of chronic disease. And we also understand that it's important for our workforce at all levels, leaders, physicians, clinicians, administrative roles, and so forth, to reflect the diverse makeup of the communities that we are privileged to serve, so that we have an opportunity to have internal advisors and external facing ambassadors. Some keys to our effectiveness that I'd like to just highlight for a second is the important role of unapologetic leadership and courageous leadership in taking on the status quo for intentional and equitable transformation. Data transparency, understanding the notion that you can't manage what you can't measure and you can't measure what you can't see. Commitment to learning, mitigating bias and racism, and innovating new practices informed by evidence and the voice of the patients and communities that we're privileged to serve. The notion of nothing about us without us. There's been a lot said recently about the challenges of trust in the COVID-19 vaccination realm. And a few trust building lessons that we've learned and have integrated in our work has been one that it's important to validate the lived experience of the individuals who have difficulty trusting an entity or an institution. This is really recognizing past abuses and present abuses from a continuum. So we don't limit our conversations regarding trust challenges to the Tuskegee work, which was critical as one example, but some abuses and breaking of promises that goes on even today. So this is current thinking, current concerns. We have to strive to be trustworthy rather than put the burden of trust on the people that we're here to serve, and become a trustworthy messenger rather than just leverage existing trustworthy messengers to deliver important instructions about wellness and health and support. During the COVID-19 scenario, we have also been involved in clinical trials in some of the vaccine development areas. Kaiser Permanente is a health system, but we also operate with research and our research organization engaged in clinical trials on a regular basis. Some of these same principles that have informed our work in this space in developing diverse population and participation in our clinical trials involved eliminating barriers to participation, such as economics and distance travel with transportation challenges wherever possible, working with patient providers teams to serve as trusted messengers, folks who you already have an existing relationship with, helping you understand the opportunities for the clinical trials, as well as the safety profiles engendered. And then our trial enrollment demonstrated that the role of oversampling of our participants of color has served to help us improve our representation, and we've had significant reduction in dropouts for those who chose to enroll. So as we stand here today, in the way of wrapping up my comments, I'm proud of the work we've done to date, but there's clearly much more to do in so many different areas regarding effective practices, as well as using our voices to advance the national policy dialogue and bring about meaningful change on a long-term basis. I'm humbled and excited to hear from today's set of highly accomplished speakers and look forward to using their knowledge and pearls of wisdom to inform our own equity inclusion journey going forward at Kaiser Permanente. Thank you very much for your participation. Looking forward to a great discussion. And now back to Murray to get things started.
Thank you so much, Ron. And the point you raise on the burden of proof on the trust side, I think, is a theme that's going to be coming up a couple of times in the next little while.